So this is a BC doctor speaking out about what we were talking about earlier today about the BC healthcare systems. This is a Canadian emergency doctor sounds the alarm on our healthcare system and gets threatened with dismissal for going public. This is from Table Salt.
Our emergency system is failing. Frontline providers are not allowed to talk about it.
Emergency physician Caitlin Stockton is blowing the whistle, alleging the Fraser Health Authority threatened her job after she tried to warn patients the Eagle Ridge Hospital emergency room was at a breaking point.
The harassment and muzzling and silencing and bullying of frontline providers needs to stop.
On November 18, 2024, doctors urgently asked Fraser Health for help, saying conditions in the ER were unsafe as doctors became overwhelmed. But their requests were allegedly denied.
We were doing everything we could to treat those patients. The people working on that day unquestionably went above and beyond. Some people did fall through the cracks, and it was horrible.
With the situation spiraling, doctors posted this sign calling the wait times unacceptable. Fraser Health later obtained CCTV footage of Stockton posting it and allegedly threatened to revoke her hospital privileges and file a complaint against her. Stockton says it's part of a pattern of silencing frontline medical workers.
This happens all the time. It happens to nurses, it happens to physicians, and this is why the public doesn't really have the full truth about what's happening in our publicly funded hospitals.
The lawsuit also claims the health authority has repeatedly ignored doctors' pleas for help. It says that after the deadly attack on the Lapu Lapu Festival in Vancouver, doctors at Royal Columbian Hospital asked Fraser Health to initiate a Code Orange, a medical protocol that allows hospitals to respond to mass casualty events. But it claims that request was also denied. Stockton says she fears patients are being failed by an overburdened system where medical professionals are punished for speaking out.
It feels like one of those dreams where you're screaming for help, but no sound is coming out. And it just drains the life out of you after a while.
She says the conditions she witnessed on November 18th are playing out in emergency rooms across Canada.
Knowing that you're not providing standard of care to somebody who really needs it is a horrible feeling. It's not the way I was trained. It doesn't feel right. It's not what patients deserve.
The suit also alleges Fraser Health has failed to deal with a string of violent incidents at the hospital. As recently as January, staff at Eagle Ridge were attacked by a patient wielding a machete. CBC News has obtained a letter signed by 50 emergency physicians across BC supporting Stockton's claims. She says as she goes public, she hopes more doctors and patients will step forward demanding change.
Yeah, it's crazy. I had that one too.
Haha, beat you, bitch.
Yeah, it's just disgusting. This what's going on. It's good that it's all coming to light, though. I mean, I think it's going to happen. It's going to take a few.
Well, that was a CBC clip too, so.
Yeah, exactly. It's going to take a few brave doctors to come forward, and yeah.
The problem is how you fixing it at this point without just making all the doctors Indians.